This is Jeremy with Coronary, and in this video we're going to be going over the arterial structures of the heart. Specifically, we're going to be touching on the left and right coronary arteries and their branches. The left coronary artery has 2 branches, whereas the right coronary artery has 4. Now, the left and right coronary arteries, although they have branches, they are actually branches of an arterial structure themselves, and they serve as the first branches off the aorta, period. Specifically off the ascending aorta, and it's important to make that distinction because the aorta is divided into 3 different regions: the ascending aorta, the aortic arch, and the descending aorta, which has a thoracic and abdominal subcompartment. The reason I stress off the aorta, period, when referring to the left and right coronary arteries being branches off of it is because if we talk about the aortic arch, its first branch is the brachiocephalic trunk, whereas the left common carotid artery is the second and the left subclavian artery is the third. The right common carotid and right subclavian arteries both come off the brachiocephalic trunk, also known as the brachiocephalic artery. The left coronary artery has 2 branches. It has this circumflex branch, which is found within the atrioventricular groove or sulcus, and that groove or sulcus is also termed the coronary groove or sulcus because the coronary sinus accompanies the circumflex artery within it. That second branch off the left coronary artery is the left anterior descending artery, and that is found within the anterior interventricular groove or sulcus along with the great cardiac vein. What's important to note about this left anterior descending artery is that it is nicknamed the widowmaker because it is the primary artery obstructed with coronary artery disease, which is a subtype of atherosclerosis, usually leading to a myocardial infarction and eventually death. Hence, widowmaker. Now, the left anterior descending artery and the circumflex artery, as the 2 branches off the left coronary, we can see are both attributed to a groove or sulcus of the heart. That's important to note because there are 3 different grooves or sulci associated with the heart, and for the 2 branches of the left coronary to be in 2 out of the 3 of them, it's pretty unique, or it helps us remember which are the arterial structures in each groove. The third groove, or the third arterial structure associated with the groove of the heart, is the posterior descending artery. And in some people, this can come off the left coronary, but that's only about 10% of the population. 20% of the population, this posterior descending artery can come off the left and right coronary arteries, but majority of the time, 70% of the population, the posterior descending artery comes off the right coronary artery.